Hi, good evening, PAC Center. My name is Melissa Orr, and I am sister of Pastora Marlene Cruz. I am a drug and alcohol counselor in Pennsylvania for a halfway house. She gave me some information, let me know that you guys have been studying about substance abuse and about addiction, and wanted me to give you some information about it. We have a lot of family programs here that we share a lot of information with regards to the disease of addiction, and also just help with how to support in terms of addiction and knowing the signs of addiction, and also knowing the signs and behaviors of relapse after it is that they have stopped using. So with regards to the disease of addiction, there has been a lot of information that's been given within the past 50 years that has changed. A lot of education surrounding addiction, stating that it is a disease, a chronic disease in most cases, that basically means that there is something that goes on within the brain that people who have the disease of addiction, it changes their brain chemistry, and it causes them to not have control and have a compulsion to use. Now, that depends on on some genetic factors, meaning that there are some times where if there is addiction within the family, someone is more likely to be addicted to something. So there's some genetic predisposition, and then there's also some environmental things. So their environment is very important in addition to the genetic factors of that. So disease really can begin from just a genetic predisposition to it, or there's like a greater chance. That's what predisposition means, that there's a greater chance that they might get addiction, they might have addiction as a result of their genetic line. There are a lot of things environmentally that we can do to try to ensure that when we have the kids that are young, to ensure that they are given the best opportunity. But what we know about children, and what we know about ourselves when we were children, is that we can give and put as much protection in place, and they're always going to have a choice as to what it is that they're going to do. So it becomes a little bit difficult to really protect from those kinds of situations all the time. I've seen it very often where kids were brought up in a household with two parents who were fighting to protect them, and for whatever reason they still chose to try any kind of drugs and end up addicted. Now, for a long time there was a lot of information about that was saying that marijuana was actually something that they called a gateway drug. A gateway drug meaning that it starts at marijuana, and that it kind of opens up a lane to start to try other drugs. But what we know now in addiction is that one of the actually more times than not, the gateway drug is actually alcohol. So alcohol is something that we see, and so sometimes we don't think about it. Kids have sometimes alcohol with us first in the home, and that causes just an opening of, oh, this kind of feels good, and then it opens up a place for them to kind of just try other things and explore. So while marijuana was said to be the gateway drug, right now there's a lot of research surrounding the fact that more times than not it is alcohol. And so being careful to think that alcohol, because it's legal, is okay or is acceptable, is really not the safe way to think, because what we know with the research that they've shown is that alcohol is what more times than not leads them to try something else, like marijuana and like pills or like, other kinds of drugs. So it's important to know that alcohol is one of those leading things. So, the acceptability of alcohol is I think one of the larger problems. And now we're moving into a time where legal doesn't matter, because marijuana is in a place where it is legalized in many states right now. And there's a lot of people who are fighting against it. And, I'm not really here to take a position on it. As a counselor, I just see even the small, what people think is just marijuana, how that influences someone's life. Really, addiction itself is talking about just kind of a lack of control or compulsion, right? Something that it is like, I have to continue to do it. And the way that it affects your life is really what addiction is about. How does it interfere with my life? How is it interfering with the life of the person who is using? Are they having trouble getting up for work? Are they missing work? Are they, in cases of younger, are they missing school? Are they not doing what they're supposed to be doing? Are they choosing to do that instead of, do things that they're supposed to be doing? So sometimes it's just an interruption of a schedule that leads to the question of, is this an addiction? There's a lot of arguments about marijuana not being addictive, and what a lifestyle. It's about what it brings together with that really is addictive, the lifestyle surrounding it. So when we talk about marijuana, it's really, it's something that we have, we can say that our brain is not telling us we have to do it, but however, the lifestyle is. Marijuana is something that specifically, it seems like it's more about camaraderie. It's about being together while doing it with other people. We smoke marijuana together, and it's more of that kind of drug, which then we can talk about other things or reasons why that is happening, or that is what is important for the person who is using. So what we know about addiction is that quite often there is some kind of mental health component that comes along with addiction, meaning that sometimes it's anxiety, sometimes it's depression, sometimes it's things like bipolar, ADD or ADHD. Those kind of mental health diagnoses usually causes people to kind of move into using drugs, and it's in a way to kind of self-medicate, to use it to basically ease the symptoms of their mental health, and that is, it says a lot. And quite often we're asked the question, is it the chicken or the egg? Like, which one came first? Did you have anxiety prior, or did the addiction just simply, exacerbate the anxiety? Did it make it worse? And if that's the case, which most times the answer could be both, any kind of, people who it is that have used marijuana and or opiates, opiates are like the pills, and or other things like heroin or cocaine. There are effects to that happen because the brain chemistry is changed once it is that you are addicted. The brain chemistry changes. So in essence, it is just about just kind of evaluating what is happening. What's the purpose for the use? Is the reason that I'm using because I'm so nervous, I'm so anxious, I'm so worried, or, something happened to me and I had some kind of trauma and now I am having a hard time dealing with that. There are things called triggers and coping skills. Triggers for use are things that basically come into our lives that might cause us to say, oh my goodness, I can't deal with this, I have to go use. And that's once addiction has kind of taken over our life. And And so once addiction comes in that way, then normally it's used as a coping mechanism, and it's just a way to kind of deal with the situations. And so the lack of ability to cope with situations that come up might be another cause for use. And so when it comes to how to support these kinds of, situations, how do we support our children? How do we support our family in the midst of addiction? Well, for one, it's communication. When we're talking about younger children or adolescents, children who are a little bit older in age but are still living underneath our roof, 18 to 24, that's like, what do we do? How do we help someone who has already taken on this this addiction, or who has already kind of tapped into these drugs? How do we take that on? How do we support them? How do we help them to kind of come out? Well, for one, I think it's more about finding a way to communicate. How can we communicate what, the why? Why is this something that it is that you want to do? Why is this something that you use to help yourself? What, are you trying to mask something? Is there something that is going on within your life that is too difficult for you to kind of deal with, or that you feel is too difficult to deal with alone? And in the midst of that, it's just really trying to find a basis for the why. What do they feel is the why? Sometimes it's not, it's not anything else other than, I just want to be with my friends. I just want to, hang out with my friends, and that's what they're doing, so then we have to kind of talk about foundationally, what is the right thing in terms of what God is saying about our life. How can this be productive for you? I think sometimes we just want to rip it away and just say, this is it, this is what you're not going to do. And that can create, actually, it can kind of draw them in an opposite direction. I'm not recommending that you allow your children to use while it is that you are, they're underneath your roof. To the contrary, I think that boundaries are so super important when it comes to people who have addiction and or are struggling with drug use. It is so important that we have boundaries that say this is not okay. And when we're talking specifically about children who we've already talked to about God and God's right ways and what He wants for our lives, to specifically say, this is not the way that it is that God wants us to live, and I can't accept it otherwise. That doesn't mean that we can't help in the midst of that. It's just a matter of how we help, making sure that we are offering resources for them is the most important thing. Asking them if it is that they want to talk to someone outside. Quite often, and I have children who are teenagers right now. They're 16, 14, 12. I also have a little tiny baby, but the teenage years become difficult because most times I am not the go-to person to talk to. My husband is not the go-to person for them to talk to. And so, what do? Well, some of the foundational things of trying to set up a safe situation for people is to allow someone else to attach to them, to kind of like a mentor, but someone who is that they can trust, and someone who they feel like they can share without feeling a lot of the punitive consequences or the negative consequences, the disciplinary consequences to what it is that they are doing, so having an outlet, a safe outlet, someone who is able to kind of listen and still have the advice that is still biblically sound and still in accordance with what you want for your house as well. That's extremely important. The other thing I always advise for families is really you want to be careful to just make sure that you are also in support and that you have your own support. That there's people around you that it is that you can talk to in the midst of this as well. People who have been in addiction for some time often have something that we call withdrawal from withdrawal symptoms. Other people call them PAWS, which is post-acute withdrawal. And post-acute withdrawal is just really, it's the symptoms that happen as a result of the drug being taken away. Because what happens is with the brain chemistry changing, our body becomes physically dependent on the drugs or the substance, and it becomes difficult and in some instances dangerous for people to just completely get off of the substance, because their body is now dependent on it. And so some of those signs are maybe shakiness, irritability, lack of sleep. Sometimes it can be very emotional. I mean, and this is kind of hard to see when you have especially when they're like teenagers, and there's like all of those things can still relate to them. Like you can still it's normal things that normally happen, but I guess it would be for you to kind of observe the difference and see if you would tell that there's a slight difference in terms of irritability or anxiety, or maybe severe depression. Sometimes those things, you see them, but you can tell that they are different once it is that it's actually withdrawal from medication. So from substances. So the idea is that, we want to just we have to be present, right? In order for us to tell a difference in someone's life, we have to be able to be a constant in their life. We need to be able to constantly see what is happening, so that way we can tell the change of behavior. Behavior is probably the biggest thing. We can tell whether or not, people are fulfilling their commitments or doing what they're supposed to be doing. If they are in communication like they should be, all of those things you can tell the difference when it is that someone is not acting the way it's supposed to. And most times when they start using, it's some of what it is that you notice like something is off, like you're always in your room, you don't want to talk, those kinds of things. And or if they're not living with you, you haven't called me in weeks, I don't know what's going on, you change jobs, and whatever the case is. Excuse me. So it's just about kind of being observant of the behaviors that are surrounding their life and what it is that they're doing. And so those are some signs of withdrawal, or and just kind of how it is that they might behave as a result of that. I say that it's important to stay connected to a primary care physician or just your main, family doctor. So that way it could be a good way for them to even just be in the loop of what is happening. It changes, you get a change of appetite in most cases. And so there's several things that can go wrong, but being in communication with your medical doctor can really be helpful as well, because you can utilize them as a means to know if what they're using, or if they're using, or anything of that sort. So there are several signs for that. So the gist of it is really that we want to communicate with our loved ones. We want to find out what's going on with them, and just kind of be observant of change of behaviors, things that are different, and how it is that we can how we can just hold them accountable to what it is that they're supposed to be doing. So and together with adding support, finding someone else, another outlet for them to speak to, another person that it is that they can be in communication with in order to share, freely. And we know that they're going to get sound advice, advice that's going to point them back to God. And in the direction of what it is that we need for our household. There's quite a bit that it is that you can learn, and if you go on online, there's quite a bit of resources that it is that you can go to give you some more information with regards to withdrawal symptoms, relapse behaviors, what is relapse, what is recovery, and how to get some more support for yourself, some more information. So I hope that information was useful. I let Marlene know that if there's any questions that you would like, you could feel free to give them to her, and I would be more than happy to answer whatever it is that you'd like, or if you want me to kind of expand on anything that I maybe touched base on and didn't talk more about. But anything with regards to that, I deal with a lot of mental health and as it pertains to substance abuse, and so and I deal with a lot of family as it relates to addiction and how it is that they can be of good support to their loved ones during a difficult time, so feel free to ask any questions and to just let Marlene know, and she will get in contact with me. Thanks so much for listening, and thanks so much for having me. I appreciate it, and like I said, I'm available. I'm always in prayer, in heavy prayer for the next generation. I just feel like it is just so important for us to be connected that way. And so I'm praying for you. I'm praying for your children. God bless you. Hope to hear from you soon.